You've trained hard all your life. Your performance peaks towards the day of competition. You believe you can do it. All of a sudden, your knee gives way. Injury strikes you when you least expect it. Unapologetic, unforgiving, almost as if your career is over. As an avid sports player, I have a special interest in knee reconstruction and sports surgery. I would love to see injured players return to sport. So the knee is actually a hinge joint. Many factors need to work together to maintain its stability. When one structure fails, it will lead to higher stress on the other structures, and eventually other structures will become injured as well. Common injuries of the knee are ACL and meniscus injury. The knee may be painful, swollen, unable to move, or unable to stand on the injured leg. The knee may be locked in a fixed position, unable to bend or straighten. Some patients may feel that their knee becomes loose when they try to step on the injured leg. That is called instability. Whereas some patients are unable to step on the injured leg simply because it is painful. If you feel any of these symptoms, you should get your knee checked. Now, I get this question from the patient: if I'm going for an MRI, why do I have to go for an X-ray? MRI and X-ray, they both play a different role in the diagnosis of a knee injury. X-ray allows us to look at the bony configuration if there's any fracture of the knee. MRI, on the other hand, allows us to see the soft tissue such as the articular cartilage, the ligaments, the meniscus, as well as the bone swelling. MRI has a 98% sensitivity to diagnose the ACL injuries. Most of the time, surgeon and the patient will sit down and make a discussion. The discussion between the surgeon and the patient often takes into consideration the severity of the disease, the ability of the patient to undergo rehabilitation, as well as the expected outcome of the patient. Then, the patient, with the information provided by the surgeon, decides which treatment he or she wants. In cases with high function and expectation, surgery in conjunction with proper rehabilitation often produces excellent results. In most cases of mild to moderate injuries, the body can heal if given the right circumstances. Non-operative management of sports injuries doesn't necessarily involve rest. Prolonged unsupervised rest can lead to a lot of negative effects such as muscle wasting, joint stiffness, and loss of coordination. Most sports surgery are performed arthroscopically or via minimally invasive approach. Smaller wounds tend to lead to less post-operative pain. This allows for early rehabilitation immediately after surgery to ensure the best outcome. We put the operated leg in a brace immediately after the surgery, and we educate the patient how to ambulate with a pair of crutches. Subsequent rehabilitation is focused on strengthening as well as range of motion of the operated leg. As time goes on, we gradually allow the leg to bend more, and we remove the brace after 6 weeks to 8 weeks. Then subsequent physiotherapy focuses on building muscle strength, and we allow the patient to start resistance training. Hi, I'm Dr. Edwin, orthopedic and trauma surgeon. Walk with me on a journey to recovery.